Welcome back to the Brain Injury Discussion. This is episode 8 with your local case manager, Jay. And today we'll be talking about hyperbaric oxygen therapy, which we touched on very briefly in the last episode. So, this is episode 8. We're going to devote an entire episode to hyperbaric oxygen therapy. So, feel free to like, comment, and subscribe. We definitely like the interaction. And of course, if you have any questions, feel free to ask them. And sources will, like always, be in the description below. So, what is hyperbaric oxygen therapy? Well, according to a general overview on the hyperbaric oxygen therapy applications, mechanisms, translational opportunities, this came out in 2021, and they found out that this is used to hyperoxygenate the blood by just breathing in. So the air supply that we usually drink, normal air, is more nitrogen than anything else. And oxygen is, about 30% or so, I want to say, if memory serves me correctly. But um, in hyperbarics, you're breathing in way more direct oxygen. So instead of the air supply being mostly nitrogen, it's mostly oxygen. And according to this article, there are some accepted uses, and a few of them do apply to brain injury. Couple being, um, you know, the ones that really stuck out to me were like carbon monoxide poisoning, um, carbon monoxide via cyanide poisoning. So cyanide is a poison to the body, and it can cause carbon monoxide poisoning. Another one that is brain centric, but maybe not necessarily brain injury, is central retinal artery occlusion. So, if it and that pertains to the blood flow going to the eye. So, they also list that there's like other uses for it, like gas gangrene, wound care, and the kind of idea is to bring that oxygen via the way of the blood to the area by over oxygenation. And especially when it comes to, and another one that struck me was intracranial abscess. So we're talking about bringing that extra oxygen, and in a previous episode, we talked about the loss of oxygen. So anoxia, or maybe less oxygen, so hypoxia. Now, hyperbarics are not necessarily like very well known about, and they're still being tested for other uses. But this really came about with diving. So deep sea divers, when they get compression sickness, they would form air bubbles in their bloodstream. It would also, cause other sort of physiological damages that could be helped with over oxygenation of the blood. Now, what we do know is that the blood itself carries oxygen to the organs, including the brain, and without that oxygen, um, cells start to die. And we see this with the anoxia, with cardiac events. We see this with carbon monoxide, another, taking away of the oxygen. So when we look at this, yes, we can see how this could affect or be beneficial to someone with certain types of brain injury. A 2020 article, and it is titled Hyperbaric Oxygen for Severe Traumatic Brain Injury, a randomized trial. It was published in the Journal of International Medical Research. They found that it could be utilized, so hyperbaric oxygen could be utilized in some cases pertaining to the brain, and they note anoxia or loss of oxygen to the brain. So they're trying to increase that oxygen supply to prevent that cellular injury, that cellular damage. They're also trying to prevent that like brain swelling, and so they're trying to increase the amount of oxygen that is being supplied to these organs, including the brain, especially if they were deprived of oxygen. But they also note that too much oxygen, or the technical term being hyperoxia, um, can induce cellular damage as well. It can also induce inflammation if you do it too much. So again, that's there's plus and minuses, there's pros and cons to every benefit, to every therapy that you do, especially pertaining to brain injury. And we'll say this again, too much of a good thing can be a bad thing. So too much oxygen can be a problem. Same thing with too much carbon dioxide. So I have another article here. It was written in 2023, so this is actually fairly new. It is titled Hyperbaric Oxygen Therapy for the Management of Mild and Moderate Traumatic Brain Injury, Single Center Experience in the magazine World Neurosurgery. They find that there are a lot and millions of traumatic brain injuries across the world every year, and tens of thousands of individuals do become disabled or lose certain abilities because of those traumatic brain injuries. And it does cost a lot of money, and they cite 76.5 billion in that article every year on traumatic brain injury management. Um, and they think, due to the studies, that, some of the side effects, so the ischemia, pathogenesis of the lack of oxygenation, um, sometimes they also cite the aerobic to anaerobic metabolism, which again, that's a whole nother can of worms for a discussion. You know, the resulting acidosis from a brain injury, cellular energy loss. A lot of these myriad symptoms can happen, and some of these might be alleviated or helped or assisted by breathing that hyperoxygenated air. Now, this study did do a test. And this is why I thank my statistics professor for this. And if you're watching this, I hope you realize that your lessons were not unlearned by me. Um, this study only had 17 people, 5 dropped out due to headaches. And so there were only 12 cases that they were able to evaluate, but all the evaluations for so 12 that actually completed therapy reported success with it, or at least some level of improvement. But again, this is one study. I encourage people to do their own research to find out other things about this, and that's why I do put these sources down in the description, because without doing some research and getting multiple sources, you tend to have a biased view. So they came to the conclusion that the sequelae, or the after effects of a traumatic brain injury, whether it be mild, moderate, severe, sometimes that hyperbaric could be effective, but it shouldn't be the only thing. They said that yes, it could improve physical and cognitive outcomes, but they really had to do so by examining the SPECT scan images. So SPECT is a whole nother topic. It's a type of imaging that looks at activity in the brain. So they were able to find beneficial SPECT scans post hyperbaric oxygen treatment. And with those, they actually used surveys like the VAECI, and they found that the scores were improved. So with the hyperoxygenation, you're able to get increased blood flow to certain areas of the brain, and the brain, just like every other organ, has its own metabolism, and they found that yes, they benefited from their baseline. Now, they might not be able to say that they benefited solely from the hyperbaric oxygen, but they were able to benefit maybe with the addition too. And that's where we get into the conversation about was it this or was it not this that had the effect? So, again, this is not necessarily a new technology, but it might be newer to brain injury. And that's where I think this conversation does need to be had. So, if hyperbarics are starting to come to the forefront of brain injury, it might benefit us to know what else it's used for. And in that first article, I noted the general overview of hyperbaric oxygen. There's so far, according to them, there were like 14 accepted medical uses for it. So again, before it's accepted, they need to test it, they need to evaluate it, they need to see if it's effective. Um, because giving this therapy out to anybody might or might not work. They and it might not actually be helpful. So they do have to do testing, they have to do experimentation when they do so. So, as far as what it is currently used for, it's for air and gas embolisms, thermal burns, carbon monoxide, um, and of course cyanide poisoning. We talked about the retinal artery occlusion. Um, they also know about grafts or like skin, wound care, which again, that makes a lot of sense. They also mentioned crush injury, so if like a limb is crushed, you need hyperoxygenating the tissues to save those tissues, ideally. Compartment syndrome, the traumatic ischemia, which again could point to the brain, especially because the brain is really connected to the rest of the body. And when we separate the brain as just the brain, right, we're looking at the brain, but we also got to be thinking about the heart. We also got to be thinking about the lungs. We also got to be thinking about the kidneys filtering the blood that goes through the brain. And so when we talk about hyperbaric oxygen, we're talking about the brain's connection in with the lungs, in with the kidneys, in with the bloodstream, in with the heart. And so hyperbarics, when it comes to that, we got to think about all four of those body systems together, really, because they're all going to work to absorb this oxygen and they're all going to work together to send the oxygen where it needs to go. So I figure that kind of wraps up this episode, and we've had an interesting discussion about what may be a future therapy for a lot of brain injury, which is hyperbaric oxygen. But the key takeaways are that this is not just necessarily the brain. This is the oxygen that gets breathed in, and again, you have the airway system that goes into the lungs, which eventually goes into the bloodstream, pumped by the heart, and filtered through the kidneys to go to the brain. But, anyways, that'll do it for this episode. I hope you all have a wonderful day. Again, sources are in the description below. Like, comment, and subscribe.